I'm Dr. Michael Patterson, clinical psychologist and EMDR Europe accredited senior trainer. I run trainings and workshops for experienced mental health professionals. In this video, one of them is asking me a particular question. Please join us.
Yeah, I have got a question,
Yes.
Michael. It's good to see you again. Have you been using EMDR online? And if so, how's it been working out?
Good question. I will bet you, Francis, there are others who are saying, I'm glad Francis asked that. And I have used it online with clients. And at the start of the lockdown there was a few days of sitting, what do I do now? And one of my clients says, no, I'll wait until this is over, thinking a couple of weeks and we'll be back to normal. There were others who said, yes, I want to continue on. And so I worked with them, some of whom I was able to do the history taking online at Work to Treat, just as if they were in the room with me. And then those who was able to move forward to do the processing, some of whom had worked within the office beforehand, others who were new to processing. So what I asked them to do in terms of the bilateral stimulation was to cross their arms over like this. So they'd be tapping left, right, left, right, left, right, but also do the eye movements at the same time. And then I was able to monitor that, seeing that they're doing the right sort of speed and also the eye movements. Now, as we know, the research would show or suggest that doing the eye movements when we're sitting in the room with clients is perhaps the first line, or should be the first line, and we've got the taps and the tones as alternatives. Now, whenever we're working with our clients face-to-face, sitting in the ship's passing in the night position, we can go quite rapidly with the fingers or the pen for the clients to track. So by doing those fast eye movements, then we're taxing the working memory. Now, asking them to move their eyes on their own with them at the other side of an internet link, or sitting 2.5 meters from me in the office now, then they'll be moving their eyes probably a lot slower than what they would if they were tracking with the pen or the fingers. So by asking them to do the eye movements at their pace and taps at the same time, it means we're now taxing the working memory. And over the past number of years, then more research has come out about the impact on the working memory of doing this dual attention task of bilateral stimulation. Now, the way to think of the working memory is a limited space available. So those of you who study psychology will be familiar with the 7 ± 2, the short-term memory that we have. So this is a limited space. Those of you not necessarily that familiar with that concept, it's like in the old days when you looked up a telephone number in the telephone book, kept it in your mind, you went to the phone and dialed it. If somebody spoke to you or said alternative numbers, it was gone. So it's only this little random access memory that we have, like we have the RAM of a computer. Now, whenever the memory network is activated on its own, it can fill this working memory and it can feel as if it's happening again in the present. So it feels very present and real for us. So by doing the dual attention, the eye movements in the office, tracking the pen or the fingers back and forward, or over the internet, the eye movements in the bilateral and the taps at the same time, we're using up some of this space to do that task at the same time, which only leaves this amount of space available for the disturbing memory to sit. So it means that by our clients then noticing this space that's available, then they are learning very quickly, this is no longer a threat. It's old stuff. It's in the past. So that gets processed and then gets consolidated into the long-term store. More information comes up from the long-term store into the present, and then we process that back to the long-term store, back and forward, like a tennis ball going back and forward over the net. Now, doing the bilateral stimulation then is that they're doing a set of taps for about 30 seconds. And then I would be saying, okay, just pause, have a breath. And again, I can see that they're breathing and have a breath. And what do you notice now? So we're getting the feedback, and then just go with that. And if they're going like a speed, something like this for processing, just try doing taps a bit faster. So I'm trying to get them to speed up the bilateral stimulation so that we can tax that working memory that bit more. So phases 4, 5, 6, and then we would use those fast sets as fast as the client can manage, and then we can do the slow short sets in the preparation phase. So that's quite a long answer for a fairly straightforward question, Francis. But does it, in terms of working online with clients, is there anything else you would add to that, Francis, to ask?
No, that's given me a clear idea, which is I have a client who wants to work online, but I wanted to do this session first. So that's given me a really clear framework. So thank you, Michael.
Good, that's super. There's also a resource as well, written by, I think, was it Marilyn Luber, I think it is, on the emdrmasterclass.com /resources page. If you go on that, it's about working with EMDR therapy in the COVID-19 area. So it's more guidance on that. It's like an ebook which is published. So that's available for all of you to access. So that's